One of the first steps is to maintain. So a lot of the patients we're seeing are males, so what's called androgenic alopecia or male pattern hair loss is related to sensitivity to testosterone. And so certain medications have been proven to help minimize and stabilize the hair, such as finasteride and minoxidil. So those are always something that we recommend to help maintain and optimize hair transplant outcome. Patients who've underwent the hair transplant go through a very predictable healing process. The first couple of days, the hair follicles that we transplant and into the recipient site, those will have a little bit of oozing the first day or so. Patients leave here with a certain cap on to help protect the hair follicles as it's healing. But there's a little bit of swelling involved as well. To really help improve the outcomes, sleeping positions are helpful to sleep where your head is slightly above your heart. And then finally, there can be a little bit of crusting and scabbing that occurs in the recipient sites. Those will tend to fall off on their own. What always happens that patients get concerned about is some of the hair follicles fall out. And that's a pretty known reaction after the donor sites are brought to the recipient sites. Those hair follicles can go into a little bit of shock. But it's not to worry, those follicles will still be there in terms of the hair root. So we'll get a good sense of the outcome usually around 6 months to a year after the initial hair transplant. So it's a little bit of a process, but we'll get a good sense of it really as those hair follicles grow. And so it takes around that length of time for us to get a sense of the results.